So it is actually November 1st, 2018. This is Dr. Scott Geller, laser floater ophthalmologist. And we have a great patient now from Plant City, formerly from New York, an architect by trade, correct? But more in management now of a large organization. But you had an unusual situation. How long ago did that start with the opacity floater?
Well, I've always had floaters as long as I can remember, but in 2012 I had a retinal tear, and then there was an explosion of floaters in that year, and since then it's been gradually deteriorating even more. So it gotten to where I couldn't really read or have any usable vision in that eye.
Right.
Right
And what I saw when I observed and examined was you had what's called a posterior vitreous separation or posterior vitreous detachment. Your peripheral cornea from the old retinal tear was just fine. But unusual in your case was the fact that the surface of the vitreous gel was hazy, not the inside where we see typically floaters floating around, but the surface. So what I did was sort of bisect it with the laser. A lot of it sort of retracted, and I usually don't do that for some technical reasons, but in your case it was different. And that retracted to more or less to the periphery. So right now, what is your experience? That's the question. You had four laser sessions.
So the vision is definitely improved to the point where I can actually read with that eye now, both in up close without my glasses, which I'm nearsighted, but I can also with my glasses, read signage with that eye, while I'm driving. And so even though the peripheral vision is still blurry, I can now see clearly right through the center of my field of vision, and that's something that I really appreciate.
Yeah, and my purpose was to create more or less a little window in there. To a greater or lesser degree, I've seen patients that I've done that say they don't see much in the periphery, but everybody's a little different. Laser's easy. It's not a vitrectomy. You don't have the downside of that. You had a previous retinal tear, so that would be a risk factor for vitrectomy. But you're basically a happy patient?
Yes, I am.
Okay, that's what counts. Yep. A happy patient. We like happy patients. We like to see success. And have a great trip back to Plant City.
Thank you.